This lecture will cover the yeast and Pneumocystis jiroveci. Yeast are the cause of many opportunistic infections. This means that they can invade in a site or in an individual that is immunocompetent in some way. Yeast isolated from any sterile site is considered significant. For example, yeast found in a spinal fluid is definitely significant. It's not supposed to be there. Spinal fluid is sterile. When we look at whether or not something is significant in another site, we need to judge it based on if it's significant in numbers. In other words, when you perform the culture and you see an abundant number of yeast, then that's considered clinically significant. If it is found in multiple specimens, for example, for blood culture bottles, they are typically drawn with 4 blood culture bottles. So if you were to find yeast in 3 of the 4 bottles, then that's definitely considered significant. It can be based on the patient's symptoms. For example, thrush in the mouth is going to be based on patient's symptoms. If you see thrush in the mouth, it can be painful. So it would be considered significant and that patient would be treated. And it can also be based on the patient's immune status. For example, if a patient is immunocompromised, then a finding of yeast is going to be more significant than someone who is not immunocompromised. Environmental stimuli can affect the morphology of yeast. In other words, if it's put in a particular media or if it's put at a different temperature, then that can affect the growth or how it appears. Or if the yeast is allowed to grow on a culture for several days, then as it gets older, then it can appear different. Yeast are eukaryotic. They're unicellular, round to oval, usually about 2 to 60 microns, and they're reproduced by asexually and sexual methods. Asexually by budding, as you can see here, by blastoconidia. So you can see the little buds that come off of the mother cell. Or sexually by ascospores, here, or basidiospores. And here's an example. When culturing a specimen, we look at different characteristics of how the specimen grows on a microbiology plate to help us determine one organism from another. So to do this, we will look at it macroscopically, microscopically, and then we will also do other various tests to help us differentiate one organism from another. When we look at yeast growing on a plate, we want to see, what does the colony itself look like? What is the color of the colony? Is it white, tan, pink, salmon? How would you describe that colony? Is it demoticus? Does it have a color to it? Is it pigmented, a darker color? We also want to look at the texture of the colony. Does it look mucoid? Does it look butter-like? Does it look velvet? Does it look wrinkled? Does it look kind of like a pearl? Does it shine? Does it glisten? Is it matte? These are things that we will look at to determine its characteristics, which can narrow down the organism that it is. So when we look at yeast microscopically, we are looking at some of the different characteristics that it has, mostly in a wet mount. Does it form blastoconidia type budding? So do you have this budding like this? Does it have hyphae? So when you have the hyphae structures, it just makes a thread-like structure. Does it have pseudohyphae, which is basically budding, except you get this elongation to it? Does it form a germ tube when you do the germ tube test? So this is the start of hyphae right here. Is there size variability? Do you have some cells that are a little bit smaller than the others when they are budding? And sometimes you have larger budding. Does it have a broad base or narrow-bodied neck? So do you see some sort of broad base to it when you're looking at the budding? This one right here is a little bit broader. Or does it have some sort of narrow body here? And is there the presence of a capsule? So you can see these cells here have a bit of a halo around them. So that is a capsule. So it allows the media, the dye media that is around it, to not come all the way against the cell. So it kind of pushes back. And these are some more examples of the germ tube where you have the hyphae starting to form. And here you have pseudohyphae. So you have the budding that just keeps kind of elongating out. So you can see the buds happening, but then you can see them kind of elongating out. Some of the other conventional identification methods that we use is how does it look on cornmeal agar. So if you were to take a colony off the cornmeal agar, do a wet mount, look at it, then you would differentiate how it appears. Do you have blastoconidia? Do you have arthroconidia, pseudohyphae, true hyphae, or chlamydia conidia? The germ tube test can identify about 75% of the yeast based on what it looks like when you perform that germ tube test. Does it have that outpouching tubular form coming off of that mother cell? You can also differentiate one particular yeast from another yeast based on how it uses carbohydrates. Another differentiation method is whether it's positive or negative with the rapid urease test. And if you culture the organism on the Niger seed agar, this can also differentiate and identify one particular organism. There are manual and automated yeast identification systems commercially made that the laboratory can purchase depending on their preference. The system here is the API 20C. And what you look for with this system, this is a manual system, what you look for is, do you see a cloudiness within the well? So you can see these are negative. If you look at your results here, this one's positive, and you've got a negative followed, and then the positive, and then you have those three negative right here. So based on whether it's positive or negative, it gets a numerical value. So for example, this here has a positive, which has a 1 value, and these two are negative. So if you add these up, you would get the 1. Then you take this code, all of these numbers here forms a code, and then you would have a book or some sort of paper, some sort of document, or a website that you would go to and enter this code, and it would give you the identification of that particular yeast that matches that code. Same with this system. It would use a numerical code that you would record your data on, similar to this, and that would give you a code that you would look up. And this one is a little different based on color changes and growth patterns as well. So color changes could indicate a positive or negative, or growth pattern could indicate positive or negative. Then your automated systems, this would be the Vitec system here, and you can see it's similar. You have some color changes, and same with this one. This here is the microscan, and you can see some of the color. So with these two systems that are automated, your analyzer is looking for a difference in color change as well as growth patterns, whether it's positive or negative. As you can see here, Candida albicans is responsible for many diseases. Something that you may be more familiar with is thrush. So you see this a lot of times in a newborn or infants where they develop the yeast along their mucosal lining. So you can see on the inside of the mouth where the yeast grows. And this can be very painful. Sometimes the newborns don't want to latch on or nurse when they have this growing in their mouth. It can also cause the fungal nail infections, and one that you may also be familiar with is the vaginitis, where the Candida albicans will infect the vaginal area. And it can also cause a variety of other infections, including meningitis. So there are other species of Candida. These are usually termed non-albicans. With these, there are a variety of diseases that they do cause, and it just depends on the particular organism, the non-Candida albicans organism that's causing the infection, as to what it is. But again, these are generally immunocompromised type patients. Treatment for the Candida species are listed here, and based on the particular infection, whether it's something with the skin or the nail bed, it could be a topical infection versus something that's oral. Candida is typically normal skin flora or mucosa and digestive tract. If you've ever taken any probiotics, you can see some of these listed in some of the probiotics. It's the most common opportunistic fungal infection that there is. It's the fourth most common cause of hospital-acquired bloodstream infections in the United States. And there are several virulence factors that allow it to infect the host. Candida albicans is the most commonly isolated yeast that there is. And so typically you can do some rapid testing that will help you identify this fairly quickly from a culture. Some of the other emerging species that are pathogens are listed here as well. It's not a bad idea to go ahead and learn a little bit about these, take a few notes on them, just so that when it comes certification exam time that you can kind of differentiate these from the Candida species as far as the diseases that they do cause. And then the Candida auris is an emerging species that has developed a multi-drug resistance. It's difficult to ID with standard lab testing, and it has also been implicated in outbreaks within the hospital. So this is one that you should also be a little familiar with as to it developing the multi-drug resistance. Now what we look at in order to diagnose a Candida infection is we're looking at some of the microscopic and macroscopic appearances. So microscopic, we may take a few of the cells from the culture and look at it under a wet mount, or it could be possible that you would do a vaginal swab and look at it using KOH. So you're looking at some of the characteristics under a microscope or a gram stain to see what it looks like. So when we're looking at a wet mount or KOH prep, we're looking to see if we can see this budding here or any sort of hyphae that may be forming. When we look at a gram stain, again, we're looking for budding. So you can see some of these cells are starting to bud in this area here. And of course, when they do stain on a gram stain, they stain purple, which is considered gram-positive. But they are a lot larger than typical gram-positive bacteria. So as you look at them under the microscope in the next microclass, you should be able to tell the difference between gram-positive bacteria that are a lot smaller. And you will also get some practice in your analysis looking at yeast under the microscope. So you're looking for this budding here. When we're looking at it macroscopically, Candida albicans in particular will have a little bit of what we call feet or star-like projection. So you may see a little bit of growth from the feet where they go down into the culture. Or you can see some little rough edges that will look kind of star-like. So none of these really look like it, but you can see some of them here. will have sort of like a little feet pattern. And as they age, they can become a little bit more wrinkled, as you can see with this one, and then they start to grow down into the auger where they look kind of like roots. But typically just growing on like a blood auger plate, they will look kind of smooth and pearl-like, and you can see where they're kind of a little raised off of the plate. So they do have a little bit of a different appearance than bacteria do on a plate. Some of the other tests that may be performed to differentiate one of the Candida species from the other would be a simple germ tube. So the Candida albicans is germ tube positive. It is also urease negative. But when we look at a germ tube, we're looking at this tube here that has formed. So this would be considered germ tube positive. You also have the option of using chrome agar, and the different species of Candida will appear different on the chrome agar, so they will have a different colored appearance based on their species. Then of course there are some manual methods like we saw back on the previous slides, and some automated methods. And here you see a couple more examples of the Candida albicans with the budding and the hyphae. Cryptococcosis is a fungal infection caused by Cryptococcus, either Cryptococcus neoformans or Cryptococcus gattii. They cause meningitis and various pulmonary diseases. It manifests in acute, subacute, and chronic infections. The initial presentation is a pulmonary infection, and then it will migrate to the central nervous system, causing cryptococcal meningitis, especially in individuals who are immunocompromised. It can disseminate into painless skin lesions or endocarditis, hepatitis, or even a renal infection. Cryptococcus neoformans is a major cause of infection within HIV and AIDS patient, whereas Cryptococcus gattii is a pathogen in immunocompetent host. Treatment can either be fluconazole, depending on where the infection is, or amphotericin B in combination with the flucytosine. What you need to know about Cryptococcus is that it contains a polysaccharide capsule. This is one of its virulence factors because it can protect it from the environmental stress, and it's not typically recognized by phagocytes. Cryptococcus species are saprobes within natures, whereas Cryptococcus neoformans alone is usually associated with avian feces, particularly pigeons. Infections are acquired through aerosols when they're breathed in, and there's also a telomorphic form of the Cryptococcus neoformans. They can also be divided into serotypes. Standard testing doesn't typically differentiate one serotype for another, but there is a special agar that could be used to help differentiate those. Cryptococcus neoformans can be diagnosed based on a couple of different tests. One is the India ink stain, and you can see the halo from where you have that capsule around the yeast cell itself. So you can see where there's some space between the actual yeast cell and the ink. You can also base it on the microscopic appearance in other specimens like respiratory secretions. So you can see here where it's really refractile, and you can still see that little halo around those yeast cells. It is blastoconidia only for asexual reproduction. And you can also do a cryptococcal latex agglutination test. So this is a serology type test where you have the reagents within the kit, and you would look for agglutination on a slide. And you'll have the opportunity to do some of this testing, not for cryptococcal, but serology type testing based on agglutination when you are in your serology class. If you are going to culture spinal fluid, it needs to be centrifuged in order to get a concentrated specimen for testing. You can also look at the macroscopic appearance based on how it grows on culture. This isn't a definitive test as far as how it appears, but typically when it grows on routine fungal media, the colonies will appear smooth white, white to tan, and they are very mucoid. And they are mucoid because of that capsule that is in it. And you can also put the specimen on a special media to see if it produces the phenyl oxidase. And this is the Niger seed agar. And you can see that over here. Once it produces that phenyl oxidase, then it will turn brown. Cryptococcus neoformans is also urease positive, so you can see a rapid urease test in which it turns pink. And you can see here, if it is yellow, it is negative, and if it is pink, it is positive. Malassezia furfur causes tinea vesicolor. This is a superficial infection of the keratinized skin layers, and it causes brown scaly lesions on lighter skinned individuals and lighter lesions on darker skinned individuals. It can be a disseminated infection in younger children. Malassezia pachydermitis is recovered from skin lesions of immunocompromised individuals. Treatment can be a special shampoo or a topical azole anti-fungal. Malassezia species are found worldwide as part of normal skin flora. Most individuals are asymptomatic, and there's not really any known predisposition as to why some individuals are affected over other individuals. It can be associated with catheter-related infections from long-term use of lipids, IV lipids, and it also affects the trunk, the torso, the back, stomach, chest. It can affect the arms, the neck, the shoulders, and you can see these scaly looking lesions where they're a little bit more of a complexion or pigmented lesion on lighter skinned individuals versus where it actually removes the pigment on darker skinned individuals. Malassezia furfur is diagnosed typically just by appearance of the lesions on the skin. However, if it needs to be confirmed through skin scrapings, then those samples can be prepped with KOH and you would see the spaghetti and meatball appearance of those cells in those skin scrapings. The microscopic appearance would give a bowling pin type look to it, where you can see it kind of elongates out. And here's another example of the bowling pin appearance. Since this organism is lipophilic, typically a culture is not required, but if it is required, then it would require an overlay of olive oil. And typically you would only do a culture like this if it's suspected in an individual who has had long-term IV lipid use and it is suspected that it has disseminated. The colonies will appear creamy and white to off-white, and they may have a wrinkled look to them. Trichosporin species are responsible for trichosporinosis, which can affect pretty much any organ system within the body, and also white pea hydra. White pea hydra forms a soft yellow or pale brown aggregation around the hair shaft in pretty much any region of the body. and it's typically treated by shaving the affected area. Trichosporin is found in the soil and air in various parts of the world. It can cause white pewdra in patients who are immunocompetent, as well as in patients who are immunocompromised. However, in an immunocompromised patient, the infection can become more systemic with that trichomoniasis. It invades the cortex of the hair, causing damage to the hair. And you can see microscopically where the trichosporin has formed on the hair itself. And you can see where it will start to invade the shaft of the hair. Here you can see where it has formed on the hair itself. Diagnosis is made by taking a specimen of the hair and prepping it with KOH, and you would place the hair onto the slide and crush it. So you would crush that cemented type of nodule on the hair shaft. And then you are looking for the hyaline hyphae and the arthroconidia, blastoconidia. So when you look at the arthroconidia, you are looking for these rounded ends. And you are also looking for any sort of septate hyphae. A culture is typically not required simply because you can base it off of the infection on the hair itself. However, if a culture is done for a disseminated type infection, then it would appear as a cream-colored, heaped, and dried to moist, wrinkled colonies. So you can see those colonies here where they're very wrinkled. It would also have a positive urease test, and you could also identify it based on the carbohydrate and substrate utilization profile, either manual profile or an automated profile. Pneumocystis jiroveci causes pneumocystis pneumonia. When the organism is inhaled into the lungs, it will start to adhere to the pneumocytes where it replicates extracellularly. Then there is an interstitial mononuclear inflammatory response, which can cause a variety of symptoms like a non-productive cough, low-grade fever, difficulty breathing, and then ultimately it starts to destroy the alveolar cells. You can see a picture here where there is destruction of those cells within the lung. There is worldwide distribution with transmission person to person via airborne particles. It infects individuals who are immunocompromised, and there is a species of Pneumocystis carnii which infects rodents. Pneumocystis jiroveci is different than yeast. It is opportunistic, however, it's considered an atypical fungi. It was once believed to be a trypanosome, and then it was later contested as a protozoan parasite. It does have a life cycle of a tropozoite, a pre-cyst, and a cyst stage. Now the cyst stage is the diagnostic form. What makes it different from other fungi is that its cell membrane contains cholesterol. The tropozoite form is susceptible to osmotic disturbances, and it has 1 to 2 copies of the ribosomal subunit gene. Now it is diagnosed using specimens like the bronchial lavage fluid or an induced sputum, a nasopharyngeal or oropharyngeal sample, or a biopsy material if it is located within tissue. Stains that are used are the Giemsa stain, the cauliflower white, the GMS, and the immunofluorescence staining. There are some other methods used for identification, like commercial kits that detect the monoclonal antibodies, and nucleic acid amplification techniques. It's extremely difficult to actually culture this organism, so typically the serology type kits or the stains is what is best used. The tropozoite of Pneumocystis is very difficult to visualize microscopically. However, the cyst stage is more characteristic and easier to visualize. It is spherical to concave. They are very uniform in size, but they do not bud. They contain interstitial bodies, and they resemble deflated balls or a cup and saucer type look. So you can see some examples of the organisms depicted here in these two stains, where it can look kind of like a cup and saucer or a ball that's kind of been deflated.